Hi, I'm Councillor Lee Chapman. I'm the Cabinet Member for Adult Social Care, Health and Housing.
And my name's Andy Begley. I'm the Director of Adult Services and Housing. I think the local account's a great document because it's an annual opportunity for us to reflect on the work that we do within adult social care and beyond. I think it's an opportunity to give a real honest appraisal of the work that's been achieved over a 12-month period, but also to highlight some of the challenges that we've tried to meet during that period and the challenges ahead. And it's made up of real case studies and real individuals. And I think the fact that making it real board and friends of the board help to put this document together ensures that it's really not a document that's been written by services themselves in service speak. Hopefully it's a document that everybody can understand, can really get into the detail of what's going on.
It's more about the reality of what it's like for people in Shropshire and those people who we support and partner agencies support. What is the reality of that on the ground? Because I think without an understanding of that, we're challenged constantly in terms of our ability to deliver stuff. And I think if we don't understand what it's like, then it's difficult to improve. And I think it's got to be as much a part of that.
I think there's been a whole list of achievements that we could cite, and hopefully within the document they'll really surface for people and get that understanding. But for me, there's a wider achievement of looking at how we continue to meet rising demand, and by that I think that's simply the number of people that are requiring services or support in Shropshire. We've got an ageing population that we know about, and it's how we best use resources to meet that need. That continues to be a challenge for us, and actually creating that innovation to be able to do that. But I would stress it's not simply about a view of a service response. This is how we can use those resources collectively to support people to remain as independent as possible for as long as possible, and to have the kind of lifestyles that they want to achieve.
I think for me, a particular highlight, I think we were fortunate, we got the largest allocation of some government funding to a project called Hold, which is housing for individuals with learning disability. To be able to be there when you hand over the keys to someone who actually is owning their own home, with the help both of agencies working with us, but this additional funding that we've had and the hard work that's gone into that, I think has been really rewarding.
I think going back to my previous point about having to be as innovative as we can and how do we apply resources to best effect, that innovation continues for the next 12 months. And when we think about how services are going to change, I think that's all for the better. So we might see services, or hopefully we'll see services, use assistive technology and different technologies in a different way. And I think we've moved a long way now from just a simple pendant alarm. I think this is about how do we use universal technology that's available to us all, whether it's the Amazon Dot or whether it's using a smartphone to better effect, or whether actually a few years down the line, and we need to have an eye to this, is just what does the face of care delivery look like with all these new interventions and technologies. So that's a big area for us. So we've started a pilot last year that's been really successful, that we continue to roll out, and that's around 2 carers in a car, which is literally having a car that patrols in the evening, if you like, that provides that flexible nighttime to support to people. So that way you can see how we can use resources to much greater effect, manage money effectively, but actually improve outcomes for people as well. We've done a piece of work that started at the end of last year, and now we're rolling that forward with fire and rescue services, and that's around safe and well visits. And so that started off with your kind of smoke alarm stuff that fire and rescue services would normally put in, and that's increased to looking at trip hazards, the state of somebody's property, is it well insulated, just make sure people aren't isolated. And so when you start to bring that together, again, improving outcomes and hopefully reducing costs on services.
I've been involved in some work with partners in the clinical commissioning group, looking at how we work more effectively in the primary with colleagues in primary care and GP practices. I'm particularly excited about some work that we're beginning to develop in Whitchurch, where we're looking at a number of GP practices coming together and aligning with that with housing development and a community hub. To me, the only way going forward that we're going to continue to deliver best to those people who need our support is by working in partnership, particularly with voluntary community sector organisations, and making sure that they are properly resourced and that they're able to continue to support particularly the work around the prevention agenda, which continues to be at the core of the work that we do.
pull that together as a kind of a vision and look forward to the next 12 months, I think it's perfectly clear that adult social care and housing, public health, in isolation, really can't solve the scale problem that we're looking at across the whole. And so for me, the important point here is that it's recognising where we sit with partners and other agencies, and whether that be acute health services, primary care services, fire and rescue, or other services that are less obvious, I guess, and those universal services. How do we all come together to create a solution actually to this problem, or these problems, these demands, which are far wider than simply adult social care. So I'm hoping that the local account starts to talk to that and starts to understand that as a whole system we can really affect great change throughout Shropshire, and again drive those outcomes that we're looking for.